medications and lifestyle changes. As always, be sure to take a pen and paper to record the physician's answers to review later. Not all back pains will require treatment from a medical doctor. Certain back-related ailments are perfect candidates for alternative treatments like chiropractic care. Jonathan Clark returns now with the story of how one man was helped by a trip to his chiropractor.
Well, Dr. Walker, at one time not very long ago, chiropractic care lived on the fringes of accepted medical treatment. However, today, as statistical evidence shows that it may in fact cut healthcare costs, it's been moving steadily toward the mainstream. And arguably nowhere is that more evident than in the area of back pain treatment.
When I'm in real good pain like that, it's hard to bend, you know, like when you twist and stuff like that, you feel it. It just constantly aching pain, and it just annoys you more and more and more.
When it comes to Joe Junte's back pain, mornings are the worst. Anything over 5 hours of sleep, and he awakes stiff and aching. And as a U.S. mail carrier, aches and pains are the last things he needs.
Normal day for me, you know, I'm doing a lot of twisting and turning, bending down, picking up.
But while all that twisting and bending and lifting can certainly challenge the best of backs, he traces the true cause of his pain to his 7 years in the Army.
A lot of things we do in the infantry is walk. And when we walk, we'd have maybe a 50-pound to 110-pound pack on us. So after doing that for 7 years, you start having a little bit of aches and pains in your back.
Junte also jumped from helicopters in the Army and clearly remembers one particular jump that didn't quite follow the script.
The helicopter slowly raises up while people are jumping out. By the time I jumped out at 15 feet. And when I landed on the roof, I heard pop, pop, and I was like, oh. I was just in pain.
Joe, come on in. Just have a seat right here for us. Is there anything that's been going on that's different since the last time that we've seen you?
Really,
So still
Junte wanted to see a chiropractor but couldn't because he says there wasn't one on his base. Instead, he'd have to wait until he left the Army to find Dr. Sean Lynch.
Okay. All right. So what I'm going to do is just step around behind you. I'm going to put his problem started back years ago. And then he, quote unquote, got used to it. But really, when he stopped and checked in with his body, it was really affecting his life and his lifestyle.
Since chiropractors use diagnostic tools that are similar to the ones other medical professionals use, the first order of business for Dr. Lynch was to study Junte's x-rays. While it may sound reasonable that the patient jumped from a helicopter and injured his back, the x-ray helps the doctor rule out any other possible medical conditions, like a fracture, kidney, or circulation issues, for example.
I'm always taught that, if you hear hoofbeats, go looking for horses, not zebras. And so we start with the most likely horse is the compression and the irritation from jumping out. But I also don't want to assume that he wasn't involved in some kind of accident or hadn't had some kind of infectious process, or there was a history of other things that could be causing or related to his back pain. Okay, take a big breath in, blow it out slowly. Good.
Dr. Lynch found no other medical causes for Junte's low back pain and muscle spasms and concluded he could treat his patient's injury.
His body was constantly holding himself in a pattern that made his body then work harder and harder and harder, to where then he's generating pain symptoms from the muscles, from the joints in the body.
From the very first adjustment, Joe Junte says he felt meaningful relief. By applying small amounts of direct force through Junte's joint spaces, Dr. Lynch had successfully returned his patient's spine and joint positions to something closer to their natural order. And over a course of several visits, Junte's constant pain virtually disappeared.
After 12 visits, I really don't feel pain anymore. I don't have any of that aches anymore like I used to. And now, like every couple months, I come in here and let them just do a readjustment real quick to make sure that I'm not hurting myself anymore.
We do the work that helps create the environment for the body to heal, and then in due time, with improved circulation, improved movement, and decrease in re-irritation of the area, it heals. And people